So let's start with the bad news. Cardiovascular diseases are the #1 cause of death globally, claiming 17.5 million lives every year. And that number is projected to reach 23 million by the year 2030. But here's the good news. Cardiovascular diseases are preventable 80% of the time. Our next guest says it's never too early to take preventive measures to protect a child's heart health destiny. Dr. Stephen Daniels is an expert in preventive cardiology, and he's going to make you think twice before subjecting your kids to secondhand smoke or letting them spend hours in front of the TV or computer. Dr. Daniels co-authored and edited the book Pediatric Prevention of Atherosclerotic Cardiovascular Disease. He's the pediatrician in chief at Children's Hospital Colorado and a professor and chairman in the Department of Pediatrics at the University of Colorado School of Medicine. Dr. Daniels joins us now from Colorado. Dr. Daniels, thank you so much for joining us. Really appreciate it.
Sure, happy to be here.
Now, first of all, tell us what atherosclerosis is all about. What is it?
Well, so atherosclerosis, sometimes it's called hardening of the arteries, is a disease process that takes place really over decades. And basically what happens is there's a deposit of cholesterol or lipid on the insides of the arteries. And over time, this can build up. It starts just with a fatty streak, but over time it can build up to form what we call a plaque. And the plaque is a raised lesion on the inside of the artery, which if it gets big enough can actually block the flow of blood through the artery. And it also creates a situation where a clot could form. So this is the genesis for heart attacks and some strokes.
So we're talking about kids here. Are kids predisposed to this kind of condition, or is it something that can be preventable?
Well, so that's the fundamental question. So we know that the heart attacks and strokes occur in adulthood, but the more we've studied this problem, the more we realize that the process actually begins in childhood. And we know that there are some genetic factors that might predispose certain children to this kind of a process, but actually the more we learn, the more we realize that it's mostly about lifestyle. It's mostly about diet and physical activity and maintaining a healthy lifestyle so that these diseases can be prevented.
And that, Dr. Daniels, is obviously so universal, no matter what age, children or adults. It's all about lifestyle, or at least mostly about lifestyle.
Yeah, that's right. So children really are born with what we would call ideal cardiovascular health, meaning they have few, if any, risk factors for cardiovascular disease. Unfortunately, over time, that ideal health is lost through having obesity or higher blood pressure or higher cholesterol, or children are exposed to cigarette smoke and other things. So really it's a very precious resource that unfortunately in many instances is lost over time.
Now there are two research studies that were done in Finland with kids into adulthood that really showed a lot of different results that you definitely use in your own practice. Can you tell me about those two studies and what was found out and what the results were?
Yeah, so the Finnish investigators have done two major studies. One is called the Cardiovascular Risk in Young Finns study, and that is a longitudinal cohort study, which means individuals were recruited in childhood and their risk factors like blood pressure and their body mass index, et cetera, were measured, and then those individuals were followed over time, and they've now been followed into young adulthood. The STRIP study, which stands for Special Turku Risk Factor Intervention Program, is what we call a clinical trial, meaning that infants at age 5 or 6 months were recruited into the study, and then they were randomized either to a lower saturated fat, lower cholesterol diet, or they were channeled into a group that maintained a normal Finnish diet at that time. And again, this allowed the investigators to see the impact of that kind of an intervention from around age 6 months of life up to age 20 years.
And I would think the results were probably pretty conclusive, showing the different lifestyles did make a difference.
They were. So both studies actually have provided a tremendous amount of information for us. the cardiovascular risk in young fin study has shown that risk factors in childhood are indeed very important, and that they contribute to this process of atherosclerosis that we were discussing. And they've been able also to show that individuals who are able to either maintain a very healthy risk factor status, or even for those who developed risk factors during childhood but were able to improve moving into adulthood, have the best situation in terms of risk for cardiovascular disease. The STRIP study shows that a lower saturated fat diet is indeed safe. It's associated with normal growth and development, and also creates a situation with lower cholesterol levels for children, and again, keeping them at lower risk for heart disease.
Dr. Daniels, I got to ask you just a really just plain Jane question, and it seems that it's pretty logical, that it's pretty practical just to know that, sure, eating healthy, moving more, and just leading a better lifestyle is really the answer. Doesn't it seem so simple, but why do we seem to see this increase in heart disease, even amongst children?
Well, it's interesting. So the concepts are very simple, but the practical aspects are very difficult. And the problem is, and this is a worldwide problem, that we face an environment with our food and our physical activity where, unfortunately, children are channeled into less healthy eating. They're eating fewer fruits and vegetables, for example, and drinking more sugar-sweetened beverages. And they're also getting less physical activity. They have many more options for being sedentary than they ever had in the past.
And Dr. Daniels, I remember reading that in my research about 60 minutes a day of exercise for kids. You know, I love exercise, but I was like, wow, that seems like a lot for a daily routine for a child.
So it does seem like a lot, but remember, it doesn't have to happen all at one time.
Right.
So actually, children are very good at doing short bursts of physical activity, and we need to make sure that they have the kinds of opportunities throughout the day where they can get these periods of physical activity in. And there's actually even more evidence now that being active creates a better situation for learning. So kids who are more fit and doing more physical activity are probably better equipped to perform well in school as well.
Right. There's another important aspect that we should talk about, which is the dangers of secondhand smoke. And that's been shown in the research to do a lot of damage to kids. Talk to me a little bit about the importance of keeping kids away from that secondhand smoke.
Yeah, so actually one of the more recent publications from the cardiovascular risk in young fin study addresses this very question. So they looked at children who were exposed to parents who were smoking during childhood, and then looked at a measure called carotid intimamedial thickness, which is a way of measuring atherosclerosis when those individuals became young adults. And what they found was that the children who were exposed to secondhand smoke, in fact, had more atherosclerosis, more evidence of atherosclerosis than the ones who were not exposed.
Dr. Stephen Daniels, thank you so much for your time. Definitely appreciate the information.
Thank you.
We'll be right back with this week's Full Frame Close-Up.